Hello everyone, this is Dr. Shishma Sarula, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about what are the best treatment options available. Right now we are coming to the conventional form of treatment, which is allopathic form of treatment. Here we have three kind of options. First one is the hormonal therapy, second one is the non-hormonal therapy, and third one is the surgical option. First one is the hormonal therapy. In the hormonal therapy, what will happen is that usually they will be giving you, if it is a drop in normal E2 and P, that is progesterone, or if there is only a drop in progesterone, or if there is increase in estrogen, whatever differences are happening inside your body, according to that hormonal pills will be prescribed to you. Usually they will prescribe POPs or sometimes COCs, which is combined oral contraceptives, or they can give you a Mirena sometimes if you are in the reproductive age. But since we are discussing only about menopause, usually they will be prescribing you hormonal therapy. So in hormonal therapy, apart from taking these medications, you have to understand that these medications will help you in managing the overflow that is because of the bulky uterus, or because of the fibroid combination with bulky uterus, or because of the adenomyosis with bulky uterus, right? As soon as you stop taking these oral contraceptives, there is return of the condition because the hormonal fluctuations which are there, or because of the excess estrogen dominance which is there, that is not being treated, it is just being managed. So there is repetition or recurrence. Apart from that, you have to understand that hormonal therapies have its own backdrops or we can say side effects. What are those? You can increase weight, you can start having skin which tends to be much oilier, your hair can start falling off, you can become a little bit more darker, and then if you stop in between or stop taking these pills for 5 or 6 days, you just forgot to take, you were on a tour, you can experience what is called as mid-menstrual bleeding. Now coming to the non-hormonal therapies, they will be prescribing you NSAIDs, which are non-steroidal anti-inflammatory drugs for your pain, especially because bulky uterus has pain associated with it, and also if bulky uterus is complicated or caused because of adenomyosis, that can also, the pain scale can drastically increase, so they would be giving you NSAIDs, right? If you're using these NSAIDs directly and without any proton pump inhibitor, it can damage your gastric lining or the gastric mucosa, you can experience gastritis. Apart from that, if you're using NSAIDs for a longer period of time, you can experience kidney symptoms. And if you're using this proton pump inhibitors along with NSAIDs for a longer period of time, your absorption capability of the nutrients can decrease. And also, if you're not responding to any of these hormonal and non-hormonal therapies, they would advise you for a surgical option. So coming to the surgical option, they would advise you for a hysterectomy. So hysterectomy, if you're doing hysterectomy in your 40s, you can experience menopausal stages, that because you're just taking away the uterus, which is representing the symptoms of hormonal imbalance, and you're not doing something for the hormonal imbalance, you're just taking away the symptoms of hormonal imbalance. So it can show anywhere in the body, it depends on each person, right? This is how conventional form of treatment treats you. But as you can see here, it has its own side effects and it has its own backdrop, you can say it has its own backlashes. So we need a medicine which has no side effect, which does not cause any sort of removal in the organs, which does not involve in removal of the organs, which does not cause your gastric lining to be decreased or irritated. So that is nothing but homeopathic form of treatment, where we understand the link, what is the cause of the hormonal imbalance. So is it just the age, or is it something related to the stress, or is it something related to your food pattern, or is it something related to your other hormones which are influencing these hormones to become fluctuated. So we are understanding the link here, and we are going to prescribe a drug or a remedy, as we say, where it is completely custom made for you. It is very individualistic in nature, and you will start experiencing hormonal balance, you will start experiencing menstrual irregularities will come down, menses will be much regular, as it should go on, like it should slowly gradually decrease. The same thing will go on with homeopathic form of treatment, completely safe, much effective, and if taken timely. And then not only that, because we're understanding the link here, any sort of other associated symptoms with these hormonal fluctuations will also come down, that is your hair fall, your acne skin, or your low energy or low libido level, everything will become normal. Okay, so the condition is relieved, it's cured, and the recurrence rate is much less compared to allopathic form of treatment. Coming to the consultation options here at Fidicus Homeopathy, we have two kinds of consultation options. One is online consultation, the other one is offline consultation. If you're someone who's staying nearby the nearest branch of Fidicus, you can come and contact us in person. If you're staying far away from us, you can contact us online, either through audio consultation option or through the video consultation option. Once you've contacted us and you've taken doctor consultation and investigations are verified. Especially to the online clients, medicines will be door delivered to you. If you're staying in India, it can take 3 days, 3 to 4 business days. If you're staying in USA, 3 to 5 business days. Apart from that, across the globe, you can have 4 to 8 business days for our medicines to reach your doorstep. If you're someone who is suffering from bulky uterus or any other female reproductive organ diseases, you can contact Fidicus Homeopathy. This is our number. You can call us, WhatsApp us, or messages on this number. Apart from that, if you want to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. So here we have discussed how homeopathy is much better form of treatment than the conventional form or other forms of treatment, right? And how homeopathy is much effective and also much safer. Right, in homeopathy, why should you choose Fidicus Homeopathy? Because Fidicus Homeopathy stands for highest chance of health. Here we follow 3 clear principles. What are those? First one is high success rate. We are already experiencing high success rate in treating bulky uterus, in treating adenomyosis, endometriosis, fibroids. So the success rate is really good. And apart from that, the treatment here is transparent. There is no gray area between the patient and the doctor. Everything will be clearly explained to you. The prognosis will be explained to you. And the personal care here at Fidicus Homeopathy is top notch. Any sort of queries, any sort of myths that you're having, any sort of doubts that you're experiencing, or any symptomatic doubts that you're having, everything will be cleared out. So if you want to choose cure, if you want to choose health, choose Fidicus Homeopathy.